Talk about a multi-trillion-dollar challenge. Something on the order of 86% of all healthcare expenditures in the United States are related to chronic diseases, everything from congestive heart failure and COPD to diabetes. And yet, with the right level of monitoring and coaching, it's possible for patients to avoid hospital stays and maintain stability. A couple of years ago, a startup based right here in our region began selling a new mobile phone-based service to health plans and employers that makes it easier to track a patient's condition and coach them on behavioral changes to help them stay healthier. The company is called Wellbridge. It's now operating in more than 20 Pennsylvania counties. And Pam Greenhouse is Chief Operating Officer of Wellbridge Health. And welcome. Good to have you here.
Thank you. It's nice to be here.
Yeah, so how about it? Where did Wellbridge come from? What was the opportunity that the founders saw?
Well, Wellbridge was founded by Dr. Daniel Rosen. He's a professor of social work at the University of Pittsburgh. And it really grew out of his work providing care and services and research working with underserved communities. So you're correct that the problem with chronic disease and healthcare expenditures in the United States is enormous. It affects the underserved communities disproportionately. So that's really where the idea came from.
And better management of these conditions can really make a material difference in terms of the costs as well as the well-being of the patients?
Absolutely. When you're talking type 2 diabetes, congestive heart failure, asthma, much of what leads to the diagnosis and the course that they take is preventable. So this is something, you know, our focus is really on reducing avoidable emergency room visits and hospitalizations, and we've developed a very unique approach to do that.
Well, and how does that work? It's like cell phone based, or sort of an app that people can use?
It is. We do this in two ways. So there are a lot of apps out there. There's a lot of health coaching out there, and we've married them in a really unique way. So we talk about being both high tech and high touch. So we provide our members an app on an iPhone. So we provide the phone, and they check in with their symptomatology every single day, 7 days a week, 365 days a year. It's so simple. It takes about a minute. And
about a minute? Well,
about
what do
a
they
minute.
do with their cell phone? Hi, I'm here. I'm okay. Thank you.
No, they don't have to talk. They don't have to type anything. It's really some very simple questions related to their chronic disease. Are you dizzy? Are your ankles swollen? And some icons where they might press a picture that says not at all, a
Just
little,
like a multiple choice test,
multiple
but done
choice.
more with icons and pictures.
Absolutely.
And only a few questions on some of these conditions can tell you if they're going south or not?
Only a few. They can tell us whether there's some sort of symptomatology going on that we should reach out to them immediately and either just investigate a little bit or do something a little bit more than that, so that we can get them the right care at the right time in the right place. Not everybody has to go to the ER or has to have a hospitalization.
Or you could tell them here's something to do instead. That
Absolutely.
Would avoid that kind of a visit.
Absolutely.
So that's the high-touch part of this high-tech approach, right?
Exactly. And then we do another step, which is using that same iPhone, we do a weekly video chat, face-to-face video chat, not by telephone.
Okay.
The member with one of our master's trained health coaches, and our health coaches are trained in behavior change theory, and they have training in chronic disease management, exercise physiology, nutrition, social work, etc. So they're working with them not on that immediate response, although they do that as well, but then also on a more medium and long-term effort in terms of behavior change and lifestyle choices, so that our members can better self-manage their chronic disease, because they won't always be with us.
Sure.
So we want them to be able to self-manage again, so they're not always ending up in the hospital, in the ER, and so that their lives are better. And again, we're reducing those costs.
Yeah, so you've been at it for a few years now. Do you have a sense that it's making a difference?
It's making a huge difference. Our outcomes are exceptional, both in cost savings, in return on investment to our client partners, as well as in our members' ability to self-manage and improvement in their quality of life. We've seen an incidental improvement in our members' depression scores even.
Wow.
Right.
So you would get paid by what, the health plans or the employers that have you then provide this service to their client base?
That's exactly right.
Base, right.
That's exactly right. The members themselves don't pay us. It's the health plans and the employers, and we're really focusing on their highest cost members.
Okay.
The members, about 17 to 20% of their members incur about 80% of their cost.
So, and if they don't, you mentioned, so a lot of this are sort of lower income populations too. If they don't have a cell phone, you actually give them one.
We can provide the phone and the data plan.
Really exciting stuff. So if employers are interested in finding out more about the program and how it works, how do they find Wellbridge?
They can find us on our website, wellbridgehealth.com, and we also have a 1-800 number.
Okay.
So they can find us either way.
All right, now with the internet, it's gotten so easy. Really exciting stuff. Congratulations on the growth of the firm.
Thank you.
Pam Greenhouse from Wellbridge Health.
Thanks.
Thanks a lot. And we'll be back in a minute with a little bit more of our Regions Business. Stay with us.